would say I said earlier, early treatment is key to addressing issues associated with the eating disorder. Now, the stage or the level we need to start looking out for a doctor is when we start skipping, or when an individual starts skipping a meal, then making excessive excuses for not eating. Then we also talk about someone that engage, even when you know that person is losing serious weight, is engaging on excessive exercise. Then other people that are using a severe use of or excessive use of laxative, you understand, something to make them purge or lose weight. So once we find out this kind of people, it means that is the stage for you to start seeing a medical doctor, because that is because early treatment is key to addressing eating disorder. So
Hi, welcome to another episode of the Vital D podcast, where we discuss about vital information concerning health. I'm still your host, Etimbuk Bain, and today we are going to be talking about a very vital information, eating disorders. And I'm here with my partner, Fam David. Welcome to the show, Fam David.
thank you for having me.
Okay, I believe that eating disorders are a great concern on health. Can you please explain what eating disorders is and why is it so alarming and concerning?
Okay, like I said, thank you so much for having me. Eating disorder is one of those silent killers that people don't really know. It's one of those serious health conditions that people don't really pay attention to because they feel there's nothing is really wrong with them. So I will say eating disorder are just a physical and psychological condition in which an individual has severe concern or disturbance regarding in emotions and thoughts regarding food. They are not having, that means they are not eating well because of their eating behavior. So they have severe disturbance in thoughts and emotion regarding food, thereby leading for them not to see food as being healthy to them. So once someone expresses those kind of attitude regarding food, you have very big concern and fear about eating. That means the person has a eating disorder, and it puts a very serious effect regarding health, or regarding the physical and the mental health of an individual. So we should pay attention and know this thing because it affects most people in our society.
That's quite alarming. What are the causes of eating disorders?
A lot of factors could give rise to the occurrence of eating disorders, starting from genetic factors. If you are from a family that has history of eating disorder, the possibility that it could come back in future in that family is there, just like every other conditions, like those chronic conditions that we can always link back to the family. So family history, that genetic factor, is a very key factor number one that we'll look at, that could give rise to occurrence of eating disorder. We're also going to look at psychological behaviors now, or psychological problem factors. Now, psychological issues such as depression, anxiety, those mood swings, those could also give rise to eating disorder, right? Because sometimes when you are down, you are depressed, you will not pay attention to food. You are no longer concerned about what you want to eat. You are just concerned with what is happening around you. So that could also give rise to eating disorder. We also look at biological factors. Now, biological factors such as the imbalance in hormones that regulate mood and appetite, those could also give rise to the occurrence of eating disorder, because once there is imbalance in the hormone that regulate your mood and then appetite, it means you are no longer feeling the need to eat. You're having maybe mood swings. Those hormones that are not having a stable balance of how it's supposed to be regulated, once there is a deformity or defect in any of those things, that could also give rise to eating disorder. Then the last one I will mention here is a environmental factor. Now, we are living in an environment that people bully one another because of the stature of that person or the physique of that person, and this is very common among the ladies. You see someone wants to have a flat tummy, and as such you will not be eating again, or even when the person is eating, is staying away from certain class of food because he wants to have a flat tummy. You understand? So environmental factors or social behaviors like that, you understand, could give rise to the occurrence of eating disorder. So these are major things that we have to look out for, and those are things that could give rise to eating disorder in our society.
Thank you very much, Fam David. What are the possible signs and symptoms we could observe?
There are a lot of signs and symptoms of eating disorder that we could observe. But before I go into those signs and symptoms, I would like to talk about the various types of eating disorder, because it's from these various types of eating disorders that we have that we can now mention the various signs that will be very, very eminent for us to understand in this show today. So let me start by saying, talking about the various types of eating disorder, like the anorexia nervosa, for example. Now, that is the number one type of eating disorder in which one has severe restriction regarding food. Like they don't eat at all. They have very severe restriction regarding food, possibly because of the fear of gaining weight, you understand, and distorted body image. There are a lot of people that have worked out so far, like putting so much energy to get a particular physique, that is why the ladies, let me use the ladies for example, that are putting so much effort in the gym, session, diet and other stuff for them to look healthy and then maintain a particular physique. Now, that fear of them eating or gaining weight is always there. So as such, they avoid food. In fact, that fear of eating is their major challenge. So people like that now are having this anorexia nervosa kind of eating disorder. Then we talk about the bulimia eating disorder. Those are people that have episode of binge eating. That means they're eating large quantity of food, but over time they then back it up with compensatory behaviors like vomiting, excessive use of laxative and other behaviors, excessive exercise. You understand? Because they're always feeling, after eating, you are now feeling ashamed of what you are eating. You get, because you have added so much to your tummy that you now feel ashamed. Then you now want to back it up with attitude or substances that will make you to vomit, substances that will make you to lose the weight or lose those food immediately. Then you now engage yourself in excessive exercise. So once you do that, that means you are exhibiting bulimia and nervosa kind of eating disorder. Then we talk about the third one that I will mention today is a binge eating disorder. Now, that's the type of eating disorder that characterized by recurring episode of eating large quantity of food. You understand? So you eat a very large amount of food, but instead of backing up with compensatory behaviors like vomiting, purging, all those things, you just leave it, and then you are feeling guilt or ashamed of what you ate. So once you do that, you're having a binge eating disorder. Then the last one I'll mention is a avoidant or restrictive food intake disorder. That is when one or individual avoid a certain class of food for the fear of gaining weight or whatever. And now once you avoid a certain class of food, you are also going to lack those basic nutrients those class of food supposed to offer, and as such you'll be malnourished or you not have the nutrient you really need, your body need to function effectively. So having said these various signs, having said these various types of eating disorder, so the major signs of eating disorders are just number one on my list will be weight loss. Those guys always have a lot of their weight will be decreasing and they'll be losing weight as fast as much as they can, because even when some of them are overweight, or even when people tell them they are losing weight, they still assume or see themselves as being overweight. You understand? So that is a major sign of that. Then they stay away from food, like we said before. Then the excessive fear of gaining weight. Then social withdrawals. You understand? They withdraw themselves from the society because of fear of bully, or then fear of what people will talk about their status, their physique. So those are the signs and symptoms. Starvation, fasting, excessive exercise. Like, it's not as if this exercise that they are doing it for their own physique or anything, because they just want to maintain a particular situation so that they will not eat more. So once you back up yourself with those kind of attitude, that means those are the major signs of eating disorder that I will discuss with you today on this show.
Okay, thank you very much. And today, if I'm David, today you have been attacking the ladies too much, and also the cause of signs and cause of eating disorders. You have not mentioned the country as being a cause.
I'm not attacking the ladies. I'm just saying because most ladies are concerned about how they look, especially the issue of flat tummy. You understand? A lot of ladies can go as far as not eating for a particular day just to make sure they have flat. In fact, okay, let's talk about this product that the ladies wrap around their belly. You understand? In fact, I've seen a lady that when at event after eating, like, I look at that tummy, I know she's wrapping that tummy wrap of his stuff, but the way she was feeling, so well. So that's why I'm not attacking. I'm just saying the reality of what it is. You understand? So these things are very common with ladies. You understand? Not as if guys do not express eating disorders, or they do not. It's not common with guys, but I would tell you that it's very common with ladies because of that social behavior, or that kind of let me say, how will I say, bully or fear of them gaining weight or distorted the body image. You understand? For example, someone that spends so much on diet, do you expect the person to just give it all like that? And it takes, I don't know whether how many guys out there will really pay more attention to diet, like say I want to lose weight, I want to do this, unless the person is obese. But I know a lot of ladies that will in the evening, naturally they're supposed to eat a particular food in the evening, but because of I don't want my tummy to come out, they will stick to I'm not eating in the evening, let's go for fruit. You understand? But me and you know that those fruits is not because they really want that fruit. It's just because they are afraid of gaining weight. So once you do all those things, those are eating disorders. And funny enough, we don't really pay attention to it because even a lot of people don't even know that they're exhibiting eating disorder in a way. You understand? So people don't really know that they're exhibiting eating disorder in a way because most people are not aware of it. So, but with this now, even you, I know you are aware of it right now, that a lot of guys out there, both the boys, both the ladies and the guys, but 80% to the ladies and then maybe 20% to the guys will always exhibit eating disorder.
As a lady, I feel so attacked. I feel so attacked right now. Okay, can you elaborate on the dangers of eating disorders?
Okay, there are so many dangers associated with eating disorders, but I will factor into two. We talk about the physical dangers associated with eating disorders. We also talk about the mental issues, dangers associated with eating this. Now, the physical issues is that once someone has a exhibit element or symptoms of eating disorder, the person could be at risk of organ failure, for example. That's in severe cases. Then we want to talk about bone density loss. We now talk about something like the heart issues as well. You understand? Because you're not getting the right amount of nutrient your body need to function effectively. We can also talk about GIT effect. You understand? That's gastrointestinal problem. We can also talk about being malnourished. You understand? They will not look healthy. Even if when they want to tell to them, they want to say to themselves that they are healthy, they are fine, but looking at them, most of them will be very underweight, but they will still be feeling that they are gaining weight when they are not gaining weight. So those are the physical dangers associated with eating disorder. Then when we talk about the mental dangers associated with eating disorder, I will now mention something. I will talk about something like depression. You know, a lot of people with these issues always come down with severe depressive mode. Then we'll talk about mood swings. You understand? You know, a lot of mood swings, they will not be happy with what is happening around them. Then we also talk about anxiety. Anxiety is one of the elements and dangers here with that is the mental eating disorder. So in all, I will now say that the dangers, like I said earlier, I now factor them into the physical dangers associated with eating disorder, in which we have mentioned something like the organ failure in severe cases. Talk about loss of bone density. We now talk about something like we now talk about something like the GIT problem. But when you mention mental dangers, we now talk about something like depression, talk about anxiety, then we also talk about mood swings. Those are the dangers associated with eating disorder that we should pay attention to.
Okay, thank you very much. At what stage do we need to see a doctor concerning this eating disorders?
I would say like I said earlier, early treatment is key to addressing issues associated with eating disorder. Now, the stage or the level we need to start looking out for a doctor is when we start skipping, or when an individual starts skipping a meal, then making excessive excuses for not eating. Then we also talk about someone that engage, even when you know that person is losing serious weight, is engaging on excessive exercise. Then other people that are using a severe use of or excessive use of laxative, you know, something to make them purge or lose weight. So once we find out this kind of people, it means that is the stage for you to start seeing a medical doctor, because because early treatment is key to addressing eating disorder. So at that level, they need to see a medical doctor to get proper counsel, and then possibly initiate them into treatment as soon as possible for them to get out of it.
Okay, thank you very much. What are the diagnoses of eating disorders?
Okay, the diagnosis of eating disorder, I will range it into two classes, in which, because I will say we have the physical diagnosis, in which we can now group into into the physical aspect of it and the psychological aspect of it. Now, the physical diagnosis is when we now look at the basic symptoms, in which we analyze those symptoms we mentioned earlier, like look at weight loss, the state of that, the health state of that person, in which we also look at the vital signs. That will be done by a nurse. Then we also look at the the history of that person. Those are the physical diagnoses that will be done. Then when we now talk about the psychological diagnosis, that's when you can use the most popular one, the SCOF questionnaire. That's when which this SCOF questionnaire is made of 5 questions. When you look at the S, the C, the C, the O, and then the double F. Now the S being for sick, and then the C being for control, then the O being for one, and then the F, the first F being for fat, and then the last F being for food. Now, for every client that have 2 to 3 years of this question once it's being asked, that means the person might possibly have one of those classes or one of those type of eating disorder. So once we ask the question, this like now, how was your behavior regarding food, for example, and the person express and he say yes to that person in that kind of in that question, it means well, and then we have up to 2 or 3 years to those questionnaires that we are asking the client. It means the person has one type of eating disorder that we need to address. So once we key into the physical examination and then the psychological examination of this person, those are the best diagnoses one can get when regarding or when treating eating disorder.
Okay. Is there any treatment plan for eating disorder?
Yes, there are treatment plans for eating disorder, but the treatment plan are, like I would say pharmacological treatment plan and then the non-pharmacological treatment plan. But once it concerns eating disorder, I think the bulk of work is on the non-pharmacological treatment plan, in which we are now going to look at psychotherapy and then nutritional rehabilitation. Now, in psychotherapy, that's when we are going to look at the person's state of health first, in which we are going to look at the person's behavior regarding food. In that's when we can now bring out the various types of therapy. Even like we can look at the cognitive behavioral therapy. We can look at behavioral therapy. Then we can also look at family-based therapy. So once we initiate this into the treatment plan of that patient, that means we are going to get the best out of it. Then on the psychological therapy treatment plan, we are now going to start. That's counsel session will come in which the patient will now be in which we are going to help the patients to get out of unhealthy eating habit. Then we exchange the unhealthy eating habit with healthy ones. Then we also now to start to initiate the person to gaining weight. That means to have a healthy weight, because in BMI, that's the body mass index, they say it is a percentage of a particular weight that we can say this guy is underweight or this guy is overweight, for instance, as the case may be. Now, so at the psychological therapy session or treatment plan, we are going to look at the weight of the individual, in which we are going to try to bring the weight back to normal at least. They exchange unhealthy eating habits with healthy ones. Then also rule out the excessive use of laxative, for example. Then all those compensatory behaviors under those therapy sessions and those counsel sessions, at that level, those things will be cut out, so that because we are trying to bring the person back to normal. Then we also now look at the nutritional based therapy. That is nutritional rehabilitation. Now, this is when a dietitian or a nutritionist develop an individual based plan, because we are trying to bring the person to gain weight and then to initiate the person back to society. So now the nutritionist and the dietitian will develop an individual based diet plan that will suit this client. So at that level, the basic nutrients and the vitamins the individual need will be incorporated into the diet, in which we are going to be talking about something bringing. The dietitian will develop a treatment plan that will based on diet. That's a balanced diet that will suit up the person's and then bring back the person's health back to normal. So those are the major non-pharmacological treatment plan for the patient. But when you talk about pharmacological plan, in which we use the use of medications. Now, medications on its own do not treat eating disorder. No matter how you use it, you always have to back it up with non-pharmacological treatment, which is the psychotherapy and nutritional rehabilitation. But if you just walk into the hospitals or maybe a community pharmacy, get a particular drug or a particular prescription drugs because of, say, it's being used for the treatment of eating, you cannot address that. So the best treatment plan for eating disorder is always non-pharmacological treatment plan and then a pharmacological treatment plan. Now, you combine both of them at once, because the major one that plays 80% of treatment effect or give you the best result is psychological treatment and then nutritional rehabilitation. Once you rule out these two and then you focus on using only drugs, you are not getting the best out of it. So to get the best out of the treatment plan, we need to always incorporate those two. That is the nutritional based rehabilitation, a psychological therapy, and then we can now back it up with a pharmacological treatment plan. So those are the treatment plan that we can achieve the best for one with a eating disorder.
Okay, thank you very much, Fam David. What is the role of the pharmacist in this eating disorders crisis?
The pharmacists play a very vital role when it comes to eating disorder crisis. They are the one that dispense these drugs to patients. Okay, let me use for example a pharmacist in the community setting, and then there's a particular patient or a particular client that comes into your community pharmacy to purchase this laxative, for example, or any purging medication over and over again. It is in your place as a pharmacist, and you have seen that the person is losing weight. You understand? Because maybe the first time you gave the person, you took the weight of that person, and then the person comes back over and over again to get this particular medication without no prescription or whatever. Now, it is in your place as a pharmacist to one day sit the patient down or counsel the client, then try to get to know why he or she has been buying this particular medication week in, week out. So the pharmacists play a very vital when it comes to trying to manage or trying to prevent the occurrence of eating disorder in our society, because they are most times the end point, the final person before the patient leave the hospital, if it's in the hospital setting, or the person in the community setting. That's the person, those are the people the patient or the client will go and talk to. So once the pharmacist is able to identify those clients that are coming in to get this particular product over and over again, it is in their place to counsel this patient, to try to know the reason as to why they're buying this particular weight losing medication or any purging medication over and over again over a very short period of time. So they play a vital role in trying to manage the occurrence of eating disorder crisis in our society.
Okay, Fam David, in summary, what's your final advice to someone suffering from eating disorder?
Okay, my summary, or in summary of what I will say to our viewers out there when it comes to treating or managing eating disorder, early treatment is key, and then educational awareness is also very key when it comes to treating or managing eating disorder in the society, because once people don't know that there is something called eating disorder, that means they'll be doing those things without even knowing the dangers it poses. Like we mentioned, one of those dangers being the mental health of that person. We also mentioned the physical health conditions of that person being affected. So once we know how serious these dangers are, then we begin to create awareness inside the community and various environment about the dangers this eating disorder pose. That means we can reduce the occurrence of it in our society. In studies have shown that one of the leading cause of death among mental health patients are patients with eating disorder crisis. So these are something that our society needs to be aware of, because once we identify these signs and symptoms on time, and then we initiate those treatment plans that we have mentioned on time, we can treat the patient and we can bring the patient back to normal, and then thereby also seeing a way through those counsel session and therapy, initiating the patient back to the society. For example, now, if someone was bullied because of the person's physique, and then the person withdraw his or herself from the society because of his or her physique, and now to initiate the person back to society, it takes time. So, and also to my viewers out there, I will also advise that eating disorder treatment is not a quick way event. It takes time because it's a gradual process. So don't feel that once you stop a particular behavior that you are going to see the change you need immediately. No, it takes time to grow, and it takes time for you to get your best, and it also takes time for you to get back to your normal life and initiate yourself back to society. So my best advice to our viewers out there is always seek for treatment, always seek for help on time. Know when you are at the risk of maybe going, or that is maybe they are the risk of having serious issues, your organ damage as the case may be, then you are not seeking help. Always seek help on time, because once you seek help on time, there will be a way of treating this thing and then getting the best out of the treatment plan that will be initiated for that person. So that will be my my advice to our viewers out there.
Okay, thank you very much, Fam David. We have come to the end of our session today, and today's topic was eating disorders. And Fam David has made us to understand everything we need to know about eating disorders. We have come to the end of our sessions today. I'm still your host, Book Ben. Please don't forget to like and subscribe to our channel. Thank you. Bye.